Louis, over to you. So we have a bio for Louis. We also would have had a bio for Kev, but we're going to let Louis explain what happened to Kev, because it's a bit sad, but it's also completely appropriate. So Louis has been called, I think, Louise or Louisa by me. Louis has also been called Preston, Louis Preston as well. So I seem to have a problem in getting Louis's name wrong. So the challenge for me for the rest of this talk is to ensure that I appropriately address Louis. Otherwise, I think we could be in for some penalty points later. So Louis is a research assistant working over at Sheffield Hallam University, working in the National Evaluation and Learning Partnership, which is the evaluation partner of Sport England for the place-based investment work. Now, you mentioned earlier that's part of Katie Shearn's team, isn't it? Katie presented for the Realist Hub a couple of months ago, so I think that might have been back in May. So if you head over to the YouTube channel, you'll probably find there's great synergy between what I think Louis is about to present and what Katie has already presented. So this involves the place-based investment work that involves evaluating over 100 place investments using configurational comparative analysis and is informed by realist evaluation. Oh, someone's got their mic on. Let's get that mic turned off because I don't think my brain can cope with someone talking at the same time as me. I think I'll fall over. So Louis is an evaluation consultant working with people to support them in adopting realist-informed methods that are suitable for complex interventions, such as realist ripple effects mapping, which is what the talk is about today. So this talk is hopefully going to give researchers and applied evaluators the opportunity to learn more about realist-informed ripple effects mapping. In essence, RREM is an integration of REM with realist evaluation. So ripple effects mapping with realist evaluation. I dare you to say that really fast whilst drunk. I think it would be very hard. We will share, so the we is now Louis, will share examples of how they have applied realist-informed ripple effects mapping in practice. And Louis, will also encourage opportunity for discussion and share advice on how they can make evaluation accessible and utilisation focused. As I mentioned, we were hoping that Kev Harris was also going to be here, but Kev has a really good excuse, doesn't he, Louis?
We'll find out if people agree.
Kev is at one of his children's graduation. Now, what are they graduating from? Do you know, Louis? Do you know them that? Would you know Kev that well?
Well, it's a leavers assembly, so yeah, in primary school.
So that is actually pretty crucial. It's like one of the most formative times of your life. I remember mine. Okay. And that's a while ago, I can assure you. That was back in the 80s. We sang something about leaving the school to the tune of Memories from Cats. And all the mums were in the audience crying. So for all of you parents then, Louis like, oh my God, because I don't think Louis is a parent yet, he looks too young. For all you parents in the audience, leavers ceremony, especially from primary school, is one of those formative things and you have to be there. So I'm sure Kev's with us in spirit and Louis will carry the charge very well. Oh, look, here we go. Look, everyone is there on Kev's course. Yes. Yes. What I can say is, for those of you who are making that transition to primary school to senior school, it just all disappears. It's great. Unless your kids are like mine and they join the choir and the drama group and then they go and help out the other years and then you have to go and attend everything all over again. But it does get easier. And then when they go to university, it just all disappears. You have nothing to go to and you wish you had kids in primary school. Anyway, before we digress and we end up talking about utter rubbish, Louis, realist ripple effects mapping. I think we're all interested to learn how this operates in practice. I'm sure there are a few people who are on this call today who don't really know what I told you it'd be hard to say. I can't even say it sober, never mind drunk, who don't really understand ripple effects mapping in the first place. So I know we're in for a treat. So I'm going to hand over to you. I'm going to put mute on in case I get any more Amazon deliveries. And we'll see you when your call is ended. What I would like to say is if everybody could please put any questions in the chat. If there's something that pops into your head as Louis is presenting, stick it in the chat and we'll come to you at the end. So see you on the other side.
Amazing. Thank you, Joe. I'm assuming, Joe, if I just get a thumbs up from Joe or Lauren that the slides are working. Perfect. Yeah.
Sorry, I was talking there and you can't hear me because I'm on mute. That's a bit stupid, isn't it? But yes, they seem to be working, and I'll let you know if we've got a problem with transitions.
Awesome, thank you. So yeah, it's really lovely to be here today, and quite the honor to be amongst so many I guess really big names across realist evaluation that are presented before and are in on the call as well. I think as has been mentioned, Kev's not been able to make it today because of his child's leavers assembly, which is completely the right decision. And I just want to give a quick shout out to Kev who will be listening to say thanks for offering to help me move house as well, to make up for not being here today. So thanks, Kev, for that. I really appreciate it. It's being recorded, so you're committed to it now. So my name's Louis Ryan, not Louis Preston, as confused many people. And I'm here to talk about realist informed ripple effects mapping. So as Joe has quite rightly talked about, how have we brought realist evaluation into ripple effects mapping? And the National Evaluation and Learning Partnership, where myself and Kev are involved, and obviously Kev representing Hartpury University in terms of pushing and leading on this work. So just to open up and to reflect and just to highlight that obviously myself and Kev would have normally delivered this as a pair. So yeah, if I take a moment, I'm just trying to get into Kev's shoes and present from his side. So in terms of the sort of positionality, the reflections for why do we want to even consider some of this work? The work that we do with the National Evaluation and Learning Partnership is very much around looking to evaluate differently, looking at, instead of traditional approaches to maybe getting people physically active, can we view this in a way that we appreciate the complexity of people being involved and getting them active? So why do we evaluate? What is the purpose of it? Is it to appease funders? Is it to tick boxes? Or is it to learn what is and isn't working and what we can then change to improve things? What do we want to happen to our findings? So Joe's talked about already having some deliveries to the house. Do we just want to turn up, throw it on people's doorsteps and run away as quick as possible? Or do we want to deconstruct it, make sense of that with people? Do we want to say, okay, this is what's coming out. What's your view? What does this look like for you? How might we use this moving forward? And whose voices are represented? So who is actually part of this evaluation process? Is it the same people, the loudest people, the people with the most, I guess, advantages in life that are representing and informing future work so that it continues to benefit them? Or is it those people that quite often interventions are looking to target, to support, to help? Are they genuinely represented? Are they part of this? And within the National Evaluation and Learning Partnership, we really want to foster that evaluative consciousness about complexity, about there being multiple influences. Lots of things are influencing people's daily lives. And actually, our evaluation needs to consider that, it needs to react to that, it needs to adapt to it. We want to have impact in our work. So actually, what might this look like? If we're getting, again, physical activity wise, 100 people active, is that significant impact? Is that actually supporting those people? Is it around changing people's approaches to evaluation? Now, one of the things that we're really passionate about, and Kev refers to Brad Cousins here, around giving people the opportunity to make sense of the findings and the research to make informed decisions. So what Cousins refers to as fostering use and encouraging that evaluative consciousness, that people are part of it, they're involved in it, and they can make those informed decisions. And on the left, just to refer to the National Evaluation and Learning Partnership, some of the resources which are later on in the slides and can be shared around some of the things, some of the public narrative and explainer documents that just give a bit more information in a way that we've tried to encourage it for people that are non-evaluators to take part in this work through the training, through the support, that it's not just an evaluator's job, but to give Sarah Stokes, a colleague from Essex Public Health team, her due credit, that evaluation is everyone's business, and trying to encourage people to take on a realist approach, especially, might not be the easiest, but we're there to support them. We're there to help where possible. So the call for complex methodologies. Now, I mean, there's very strong argument that anything involves people, involves health, they are complex. There's lots of different influencing factors, things in our control, things out of our control, things that we don't necessarily know yet, or we might never know. So these complex health interventions require complex methodologies to evaluate them. Hopefully everyone in our call or people familiar with this work will know that realist evaluation can be an appropriate evaluation approach for complex, complexity sensitive evaluations. So how can we bring together a pragmatic approach and a complexity sensitive approach, something that helps us to understand how and why change is happening or not happening, for whom and in what circumstances? We know that these approaches, like realist approach, aren't necessarily a panacea. They're not going to fix everything. Just because we've got an appropriate methodology doesn't mean that we're going to get all the answers that we need. But there is definitely scope and encouragement that we can take this on board, that we can use them to support the work, to again make those or help people make informed decisions, to understand more about how and why change is or isn't happening, and really, I guess, call for this approach. So from a realist evaluation perspective, I think one of the things that sort of across the work may be seen differently, slightly different, but what we tend to look at, especially from our work, in terms of working with people that aren't evaluation specialists, maybe new to evaluation, is trying to give them support around, well, what maybe are the three phases that we're going to focus on. So phase one, developing program theories about complex health interventions. Phase two, let's test the program theories. Let's use a range of appropriate methods, qualitative, quantitative, and support people, especially around what methods might work for their communities, their audiences, people they work with, and support them around that. And then refining program theories for future adaptation. So how can we take the learnings, the findings, what's going on, and support these people, these practitioners, these communities, to make those informed decisions. However, for anyone that's tried to introduce realist evaluation to people that aren't within evaluation, or maybe not familiar with the approach, maybe you've tried to explain it to your family about what you do as a day job, it's not the simplest thing, and trying to bring people on board with it can be quite the challenge. So we all know the benefit the realist evaluation can bring, but quite often it can be seen as lots of jargon, complex or complicated to pick up and take it on board, to use it without support. So with that might come a lot of resource that's needed, finances that are needed, time that's needed in order to try and implement realist evaluation, especially with people that maybe it's a small part of their job is evaluation. Now putting realist evaluation there can make it really difficult. And then potentially those limitations within the participatory element. So if we're trying to bring people together, we're trying to bring lots of people to come and explore some of these program theories in an interactive way, this can put people off. Just the phrase realist evaluation can be a barrier in itself. So how might we bring it to life? Who are the refinements for? Will people use the findings? Will it make sense to them? Will it have an impact on the work? From an evaluator's point of view, it might be really, really good findings, but actually it doesn't work for those people they're working with. The limits to the evaluative consciousness that it can create. So if we're trying to bring people on this journey with us, that might push people off again. And then Kev has popped a couple of papers in, including his paper with Adams around power dynamics and subjugation, which I encourage you to check out. So these conversations started, what year is it? 2026. I want to say about 3 years ago, between Kev, while he was at Hartbury University, and with Active Essex, who were they are the active partnership for the County of Essex in England. So they look after physical activity and sport across the county, and as part of the funding from Sport England for place-based work, they were trying to embed place-based working across Essex to encourage, or that long-term view, to get people active. So what things could they do over the next few years, for example, to create the conditions that enable people to have more ownership over their lives, and then therefore the opportunity to be physically active. So the conversations were had around realist evaluation and trying to engage staff and community groups, practitioners around, okay, how could we use realist evaluation? So there was some buy-in. We've talked about some of the barriers and the challenges. It's difficult to embed. There was an idea to bring this together with a participatory approach, something that's a lot more engaging, easier to partake in, and probably more representative of the work going on. People can see things and reflect in the moment, and that's where we came together with realist informed ripple effects mapping. We'll talk about that briefly, but one of the rationales I guess the key rationale for how we can bring that together is the fact that realist evaluation is open to innovation and development. There's I like the word that Kev uses here, the number of alliances over the years. So obviously referencing here with Sonia Dolkin, soft systems methodology, economic evaluation, and then Kev's work and similar colleagues around using Q methodology and evaluation, as well as collaborative approaches to evaluation. So realist evaluation has that potential to use it with multiple methods where appropriate. So this is where ripple effects mapping was quite an interesting one, because it felt different. When we did the first workshop, people were very happy to take part and to contribute, to be there, to share what has happened in their program or their intervention, their piece of work. So big shout out to Dr. James Nobles et al., who is on the paper that we'll share about realist informed ripple effects mapping. But this is taken from one of the examples that James and the team were involved in, I believe in potentially active Gloucestershire, but I might be wrong. So ripple effects mapping, often known as REM. If you do want to Google more about ripple effects mapping, I do encourage you to spell it out fully, as it's come up before. If I Google REM, will this come up? No, you're going to get the band, and you might have a good time, but you're not going to get what you think. So REM, ripple effects mapping, a qualitative method that helps to capture the unintended and the intended outcomes of the program. So traditionally, we might say you've joined this intervention, has X, Y, or Z improved. It doesn't necessarily account for those unintended outcomes. So the process involves bringing people together in those participatory settings. So quite often we're in a big room, lots of people there, lots of flip chart paper, rolls of paper, lots of pens, post-it notes, lots of interactive conversations, and it's quite often a big networking event at the same time. We get them together, we map out what has happened on the program, what are some of the key impacts, what has changed or maybe not changed, and then it helps people to sort of see over a period of time what has gone on essentially. So ripple effects mapping can help to inform program development. So what do you think is going to happen? And it can help to inform evaluation. So this is what's happened. Let's go and explore how and why that is. So we've got an example here from James Nobles and the team around a cycling proficiency program. So traditionally, this might have looked like 10 people signed up, 8 people completed the program and feel more confident. However, that traditional approach didn't necessarily capture the unintended outcomes. So 10 people signed up to training cycling proficiency training. If we look at the arrow pointing slightly up, one of the further impacts, one of the changes was that several people noticed that the local roads were not safe for cyclists. They then spoke to a local councillor about these issues. And then you'll see on the timeline at the bottom in red, 1 year later, the councillor working with the council and local residents to improve road quality. Now, if anyone was to set up a cycling proficiency training and put that as an intended outcome, I'm sure they would be told to rein their neck in. That isn't something that can happen from this training. But this method helps us to capture those things that are unintended, but actually have quite a wider impact across the system, across the sector, across the work that isn't necessarily the object of cycling proficiency training, but might highlight some of the key things that these interventions can have, especially within this work. It's complex whole systems approaches, place-based working, where so many things are influencing people's daily lives. What could that cycling proficiency training then lead to? The other pathway, the impact pathway, and when we talk about impact pathway, that's where one of these bits of text, so 10 people signed up to cycling proficiency, that is what we would call an impact. Where that connects with another arrow, we would call that an impact pathway. So 2 people started a local cycling group, and then 1 year later, that cycling group has 30 regular members who meet twice per week. So again, probably closer to the expectation of what might happen with the cycling proficiency training, but you wouldn't necessarily pin the funding down to that or set the expectation that people set up these cycling groups. So ripple effects mapping, just a quick example of what this might look like. There's so much resource out there, and James Nobles and the team have done a video series on ripple effects mapping, if you do want to check that out. What might a workshop look like? So ever since myself and Kev started doing this, we kind of expected them to look all very similar, but we found that that's not the case. In terms of the workshop length, they do tend to be between 1 hour and 2.5 hours long. So the purpose, bring people together. We do a bit of a warm-up activity, trying to explore sort of what's gone on in the program, maybe what's most important or the biggest impact on individuals, just to get them thinking about what some of their impact pathways might look like. This can be in person, which we really advocate for. We find a lot with the people that we work with that these mapping workshops tend to be the only opportunity or the main opportunity for them to stop and reflect on their work. They don't tend to do it on a regular basis. So the workshop has an element of reflecting, making decisions with the evidence in front of them, but also like a cathartic process to actually let some of those things out that they've maybe been holding on to, about things that haven't worked or have worked but maybe didn't lead to the impact that they expected. This can be done online, and the way we've done it is via Miro board or Miro, but it's very different in terms of how you engage with people and manage a group, having your own space to contribute. So it is possible online, but in person, especially with multiple participants, we tend to see working best. Between 20 and 30 people, I think we'd probably change that now. We've done workshops one-on-one, and then Kev's had this situation where people have come in for half an hour and then swapped over, and they've been done on a sort of a rota basis. We did a workshop with the North East and North Cumbria Public Health and Making Every Contact Count, the Making Every Contact Count team, where there was probably about 50 people in the room. So the less people you have as participants, the less facilitators you need. The more participants, it's a lot more helpful to have more people to facilitate. But the people that should be invited are the ones that are impacted or impacting the program. So very much those that are involved have things to say about what they've been, how they've contributed, how they've been impacted. A question around power dynamics will always be, should the people that are making key decisions be in the same room as service users, end users that maybe it's not the same, don't feel like they're on the same level, or they don't feel like they belong there, or that might influence what people do and don't put on the map. So we would begin with a bit of a conversation in pairs or threes, and sort of trying to take an appreciative inquiry approach with this element, and then visually drawing out the activities along a timeline. So lots of flip chart paper, lots of rolled out paper, doing it chronologically. Some people can work backwards, some people work forwards, but one of the key things that comes up with ripple effects mapping is what has happened. Can you put on a post-it note what has happened, what did that lead to, and start to draw out those pathways. So this is what a map might look like. We've deliberately not zoomed in, and we've zoomed out just to show you what it may look like. And every map I've done has looked different. Sometimes you'll see lots of things, lots of post-it notes that aren't connected. And from a surface view, you might see that and say, actually, there isn't a lot of ripple effects going on. Lots of this is individual actions, individual impacts, but nobody knows if they're connected or what they connect to. This, on reflection, might be that you haven't got the right people in the room, or this might be that, for example, we've done it with networks for the voluntary community organisation sector, where they've all come together, tried to map together, but they've actually reflected and gone, the work that we do is not together. We're a network in name only, and that was one of the reflections from a map. But they can be quite chaotic and messy, and this is where having somebody that can potentially look at this and sort it out a little bit. So this is a direct example of what it looked like on the day. What we would do is put this onto Miro board like this, that interactive whiteboard, and we would start to filter things, keep the connections the same, keep the dates the same, but make it a bit more useful for us as evaluators, as researchers. But I just want to say, if you're going to have a go at ripple effects mapping and your map looks perfect, you might want to ask the question about, okay, is this really what's going on? Because if I'm working in a complex environment, if I'm working with people or children or animals, things don't go perfectly. So what might be causing this? It might look perfect and it might be perfect, but I do encourage you to double check. So what is ripple effects mapping missing? And the image here, for everyone that's been part of realist evaluation talks, seminars similar, will be very familiar with the iceberg. But actually, ripple effects mapping, does it consider what is underneath the water? Does it consider what we cannot see or know at the minute? So why realist informed ripple effects mapping? We talked a lot about ripple effects mapping, bringing people together, participatory setting, especially for people that aren't evaluation minded or focused, bringing them to a session that doesn't necessarily challenge them to a new, to realist evaluation. Essentially, you're not telling them to come in, get to know realist evaluation in the next 3 hours. You're asking them to map out what they know. then the realist approach can help to identify the generative causality that can help to explain the outcomes. So quite often within our, well, I say quite often, in our workshops, we'll go around and we'll ask people, well, you've got this post-it note leading to this post-it note, this impact led to this impact. Can you tell me a little bit more about that? Can you dig a bit deeper into how and why that did lead to that next impact? And there's an opportunity to encourage people to explain the change within the moment, and to help explain the map. Like a good marriage, these approaches help to bring out the best of each other and mitigate the other's limitations. And the opportunity where this has been published, and we're continuing to work with Active Essex around this, to see where we can take this forward. But it is open access, and I do encourage people to go and check it out and see the case study that we've gone through. So the RREM model, the Realist Informed Ripple Effects Mapping model, and Kev won't forgive me if I don't point out him in his Sunday best going and presenting around this at conference maybe 6 months ago. Phase 1, so identifying the impacts and their perceived explanation. So essentially we're looking at developing those program theories using the maps. Phase 2, investigating the impacts and explaining their causes. So this is that testing phase. So actually we can do this through ripple effects mapping workshops. As people are mapping and we're having those conversations, we're digging deeper, we're testing some of those assumptions, those beliefs, those theories within the moment, and people are telling us they're adapting or they're building on their impact pathways as that happens. Then phase 3, that refinement, so learning from our impacts and their causes to inform practice. So again, within the moment, depending how you might do this, if you do a one-off workshop, phase 2 and phase 3 will come afterwards. If you do, say, 3 workshops over the course of a year, this is that ongoing process, which you can, and what we try to do is really encourage organizations and the people we work with to take that evaluation and learning as they go. So that ripple effects mapping is part of that iterative cycle. They're capturing things, they're learning from them, they're refining their program as they're working. And that's the opportunity to, again, engage people through the work. So phase 1. What we tend to start with is a discovery workshop to help focus the evaluation. So what does this organization, what does this group, this intervention set out to do? And then how can ripple effects mapping capture that? The very nature of ripple effects mapping means that we can go off very wide and far away from the program's ultimate outcomes or targets. So whilst we want to capture some of that, we want to make sure that we're capturing findings to help inform future program and interventions, as well as reporting requirements, funding requirements, similar things to that. That then helps us draw some sort of, we call it boundaries for the evaluation. So what are some of the maybe the key topics that we want to focus on? We want to encourage people to follow those ripples, but we want to make sure we are testing, we are exploring what we set out to explore. The first workshop, so what we would tend to do maybe over a 12-month period, say we did a workshop every 3 or 4 months, the first workshop, we would go and do that mapping exercise. Okay, what has happened? What did it lead to? We then look to identify those impacts and help use those conversations that we have with people, digging deeper as to why those ripples are happening, why are those impacts leading to other impacts, or maybe why they're not leading to other impacts, and use that to help us to develop that realist causal insight. And then we would, normally doing it in person, look to then digitize the map. So Miro board is one that we use because you can take a picture or upload pictures, and Miro has a brilliant stickies capture option where you don't have to manually add in each post-it note, write in what it said. You take a picture and you could 9 times out of 10 get a pretty good version of the map that you just have to add in the arrows and check the text, because as good as AI is, it's still not brilliant with handwriting and putting that into text yet. So through this, we would then look to capture those impact pathways. So rather than say, here is one impact pathway, this is my program theory, this is what is causing change to happen across this whole piece of work, this whole intervention, we would look at the whole map and look to see into the pathways, multiple pathways, and to develop program theories, those causal connections, what is causing change across the whole map. So something that represents a lot of the work, rather than say this one pathway had massive impact, this is how it works. And that would help us to have those initial program theories, which, as you may guess, we're going to move on to phase 2, which we want to then go and test. So phase 2, investigating the impacts, explaining their causes. So we've got some initial program theories, we've got some or candidate program theories. We want to be able to try and test these or explore these further through future mapping. One of the challenges that many people face with ripple effects mapping is they're quite often invited to lots of mapping events or over a short time frame. Now, for change to actually occur, we know that we need to give the program a chance to live and breathe. So we've spent 3 months between workshops and said, right, ripple effects mapping workshop 1, 3 months later we get together and meet. For some people, quite a lot has changed. For other people, nothing has changed. Nothing has actually really happened of note. So this is where, if you're going to go ahead and use ripple effects mapping, always advocate for help for working with the participants, taking that collaborative approach to understand, does this need to have multiple workshops? Could it be one at the start, one at the end? Is this a case of maybe people come in every 3 months, every 6 months, rather than a big workshop group as and when they come in as an individual organization and they contribute to the map at their own time in their own way? Otherwise, one of my favorite terms, people will suffer from REM fatigue, where too much ripple effects mapping and actually it has that detrimental impact. So second workshop that we might do, we're bringing the maps to people, saying, right, this is what the map said, and here are our causal connections, our program theories. These are our initial assumptions based on what we saw from the map. What does this look like for you? Can you help us refine it? And that collaborative process can be within the workshop, can be through those conversations continuing. But what we've been doing recently is hosting one workshop and then going out and doing focus groups, interviews, exploring further research and findings and reports from these interventions, from these pieces of work, so that we can test the program theories that way. And then, yeah, qualitative, quantitative methods, whatever's the most suitable, what's going to work, and then data analysis at the retroductive level too. Now, phase 3, what have we learned from our impacts? What is this refining? What is it causing to inform practice? What we've done in the past is use a workshop, a mapping workshop, to present not a finalized map, but the current map with the potentially refined theories, for people to again treat as that iterative cycle and say, right, here's the current map, here's the current theories, how is this working for you? What is likely to maybe happen in the next 3 months? How can you use this to inform future decisions? Does this map actually represent it? Because there might be other people in the room, other people involved that have that data, knowledge, insight that they can contribute to the map, and then that refines some of the theories as well. this has worked in different ways. Again, for some people, we've had big workshops, everyone in the room giving their feedback and informing it, making decisions. In other circumstances, it's been working with the, say, like key stakeholders that have sort of commissioned us and exploring the findings with them and supporting them to take the findings, make future actions within their work, and with their groups, their participants. So the one thing we'll always encourage is for people to take ownership of the maps. They don't belong to Hartbury, they don't belong to us, they don't belong to the facilitator per se. In this circumstance, actually, this map belongs to, say, Active Essex. They could continue to populate this for years to come, continue to use it in ways that work for them. And one of those things, the question that always comes up around that learning to action, that dissemination. Okay, well, how do we share our map? What do we do with it? That's completely up to the people that are involved in it, what they want to do. In the same way with any evaluation report, how many people do we know from an organization that will read the full report? Will they take the key headings, the key executive summary, the key findings, the key stories from it, and take that? So how might we take the key messages, the key impacts from ripple effects, realist informed ripple effects mapping, and use that to disseminate and encourage other people to take those actions on board? So we've talked a lot about collaboration, and hopefully people will be familiar. If not, do encourage you to check it out. The collaborative framework, principles to guide collaborative approaches to evaluation. And again, just to reiterate, the work that myself and Kev do very much around encouraging people to take a realist informed approach, to bring in that that causal thinking, that explanatory thinking around how and why change is happening, rather than is change happening, what it is, so that they can use that to inform their work, inform their decision, and not just adhere to increased participation numbers, for example. So please do check this out, and yeah, I can't advocate for it any more than I can than I can. So if you'd like to know a bit more about ripple effects mapping, REM, so the online training by Dr. James Nobles and Dr. Jennifer Hall. Sorry, Jen, for not shouting your name out earlier. This link will take you to that, and then the paper as well around capturing the wider impact of systems change efforts and public health. Please do go and read that, and then a couple more resources at the bottom. The Realist community and Twitter or X handles, depending on whether you're willing to say X. So the different groups that if that are around realist evaluation, if people do, I don't need to say too much about that. And then in the appendix there is a brief case study of what we did with Essex. If you read the towards realist informed ripple effects mapping, this will go into it in a lot more depth. But just for a case of what we looked at around the work that's happening in place through Sport England, trying to tackle structural inequalities to encourage greater physical activity, or tackling physical inactivity, around the investment and the example of Active Essex, the Active Partnership, the work that Hartbury has done with them to support them around evaluation, trying to utilize realist evaluation and pioneer realist informed ripple effects mapping. Just a bit of background behind them and the two topics that we focused on. So asset-based community development, ABCD, and then within the youth justice sector. So there's a couple of different examples that we did some mapping with, and I believe. Oh, yeah. So what might a discovery workshop look like? So we did this online, and we captured lots of thoughts about what is important to the work, what evidence is around to help us narrow down what we were going to do our workshops on, which ultimately led us to youth justice and asset-based community development, one of the key things here was identifying who are we actually going to invite to these workshops. We don't want people to come along that are going to be bored, not able to participate, but we also don't want people to come along that don't necessarily encourage people to share as well. So maybe there's individuals that dominate discussion, and actually we can catch up with them afterwards and give them that space then to encourage people to actually share some of the maybe the challenges that come out. And then just a quick sort of one pager around what this might look like. Say you were going to go out and plan, okay, discovery phase at the beginning. We did 4 workshops, and then what next, with a little bit. So if you are watching this, do encourage you just to pause if you want to look at it a little bit more. And then again, the examples. But I'll stop sharing my screen. That's all my slides. And yeah.
Hey, thank
Jo,
you. That was great.
What's next?
So what's next is, as Henry has already started, it's the clapping. This is where we get me clapping in person because I'm showing a certain age, and everyone else clapping online because I can't find the button. But I also think that if you were presenting in person, we wouldn't be like waving hands and we'd be actually clapping. So thank you so much for that. It was really great. I'm sure Kev, when he watches it back, will be very pleased with your performance.
I just give a quick shout out for Henry, who was my my old course leader as well when I was at university, and my teacher, and did my masters. So
there you go.
It's lovely to see Henry here.
Yeah, it's nice to have familiar faces in the audience, I think. So whilst people are having a think, let's have a look if we've got any questions in the chat. But I actually have one, and I did wonder if others may have the same, which is around, so in essence, the what I'm trying to do, I think, is understand the link between what you describe as the process, like the ripple, and then as me at home with my PhD trying to figure this out, how on earth does that translate to a program theory? How do we build the CMOCs from the data that you've got into that as a program theory? And I just wonder if that's something else that potentially people in the audience might also wish to know.
Yeah, so I think the best way to kind of look at it is like that stepping back. So whilst you've done the map, the discovery workshop also helps you starting to identify those key contexts, the mechanisms, the outcomes, and for anyone that has been involved in this type of work, I mean, they're everywhere. There's so much, and what the discovery workshop and the mapping can help to prioritize is what is important to actually take forward for testing. So whilst the connections are there, part of our job is to make sure people are explaining how the impacts, well, explain the impact and explain how they're connected, so that they're starting to generate those I guess the CMOs, and then what we're, I guess, like taking that step back to say, okay, well, almost how what the program theories for this work, and we almost start to test that through, okay, well, this is what it might look like. Is this represented in the map? Are these ripple effects actually demonstrating that? And that's almost like a layer of testing before we even need to go and speak to people.
So it's like, I suppose, like that matching, isn't it? Like it's what I think here replicated. That becomes like the data that you're testing it against. So the causal connections that you talked about earlier are do you take them as sort of like potential mechanisms? Is that what that is in, I suppose, in a realist term?
Yeah, it's one of the conversations that we had around, are we just confusing people with introducing another term through this? But essentially, yeah, what is causing that change from impact 1 to impact 2? And that's where being in the workshop is so important. Obviously, we're not there with the actual work to be like, we can have assumptions around why that change is occurring, but I guess we're being corrected and taught in time. and then we can start to see that across maybe different impact pathways. Or we saw this with Public Health Wales, where lots of the causal connections that were similar actually were because of one person, and the other causal connections that were different were different people. So that helps us to start building some of the context behind behind them as well.
Shows you how different people's contexts can actually then have an influence on those mechanisms, and then unconsciously obviously the outcomes as well.
And then
So
visualizing that as well for some people is really helpful.
I know I've got I've had a student who's done some training recently who does use Miro, and your board looks delicious compared to theirs. It's affectionately called the Wall of Crazy, but the Miro board especially can be very useful for mapping out complex connections and pathways for realist work. Although I have people call it Miro and Miro, so I have no idea which is which. Don't know.
No,
if we've anglicized it, or if it is though. Is it like IKEA and IKEA? But anyway, so we do have a question in the chat, and this is from Leslie. Is Leslie Johnson? Yeah, Leslie, you're still here. Do you want to converse with Louis directly with your question?
Sure. Can you all hear me?
Perfectly, yes.
Wonderful. Well, thanks for a great presentation. I was just curious because there's obviously an iterative series of workshops. So does the first workshop for the RREM have to happen before a program is implemented, or it sounded like it was already in motion while you're capturing those insights of the initial program theory, but just curious if that changes the approach in facilitating that, or what insights you gain?
Great question, and there is no correct way of doing it, but I guess there is a best way of doing it. And the best way is what works for you. So there are examples of people that I can't remember what program it was. They presented at the Systems Evaluation Network. I think at the same time that I presented on realist informed ripple effects mapping as well, so I might be able to dig that out. But they went back, I want to say like between 8 and 10 years to draw the map out. So that required lots of resources, lots of researchers, research assistants going back and mapping that out. You can do it at the start of the program, and arguably that's the easiest, but because you're mapping as you go. But again, at what point do you say, let's meet up every week, let's meet up every month to map it out? What we did was we just picked an important date to start with, and we thought that going back more than 12 months was probably too much time, and actually trying to capture the context of the work that far back was going to be really difficult. Asking people to hopefully recall stuff within 12 months, using their calendars, their diaries, they were part of the work, was a bit of a challenge, but a lot of people we were able to like develop things as we went, because people were sort of, they'd say one thing or someone else would say something and they would jump on that. We would put a section in for, like, say we started in January 24, we would put a section in to say, well, anything that was important to this map but happened before this date, we want to capture, but we want to make sure the timeline is still appropriate, represents what is actually going on. If you've got the resource and you can chase up those things and you have information, please do. Like, it's your choice essentially. Where we encourage people to have a go at this and to do it where they're not necessarily evaluators as part of their job, they found it easy to do like the last 3 months and then build from there, and to say maybe what are we going to expect to do in the future, or to say, all right, let's meet again in 2 months' time and to populate this. In terms of like with the initial program theories, with the work we did with Essex, I mean, God, that started in 2019, I think. So there'd already been about 4 years of work, and we'd been able to develop some program theories before we even considered ripple effects mapping anyway. So you can develop program theories just through normal methods and then do ripple effects mapping to try and test it, I guess. So it might help to do the workshop beforehand, to say what do we expect to do, but doing it during the lifespan of the program might just mean you've got some more information, some more, I guess, tested assumptions that you can have, almost like some refined assumptions as well. I don't know if that's making sense. I think you've just sent me off on a tangent, but essentially, Leslie, no, it doesn't need to be pre-implementation. And actually, yeah, if you do it during the lifespan of the program, you might have more data to take from, but alternatively, you can build program theories before the program and then just test it, say 3-6 months down the line anyway.
Does that help, Leslie?
Thank you. Yeah, and I was just imagining, I guess, having worked with several programs myself, before you implement, I think your conception of what you've planned is always perhaps a little distant. And so maybe the distance and what you're adapting over the course of the following workshops, it sounds like there may be less movement if you've already started where they can see some of the impacts versus imagining some of the perceived impacts. So that's helpful. Thank you.
Does anyone else have any other questions? Because I could probably keep going. Because I kind of always come at this from like a very practical angle. So I mentioned earlier about the wall of crazy, and the Miro/Muro/whatever it's called can be absolutely fantastic. How do you curtail the complexity? How do you know like when to stop? Because I have seen some of these boards, and I can imagine the same as with you, where you can have like arrows and lines joining all sorts of those post-it notes together. As a team, how do you try and essentially bring order and organization to the chaos?
I guess that's a bit of the antithesis of ripple effects mapping.
Yeah.
So the work that we do, I think at the minute around, okay, say 2-3 hours on a ripple effects map. So as people are doing the pathways and it ripples off and it grows and it changes, like I guess changes direction in terms of from physical activity to housing or transport, for example. Actually, they are really important parts of system change or within the system. And we could go through, do a thematic analysis, content analysis, and say, how is our work influencing or involved with transport? That might be really important. That might be a conversation in, say, 6 months' time, but we've captured that. But we found that within the workshop time, that it's like an organic stop, that people can no longer follow those lines of inquiry. So it doesn't go too far. Now, the benefit of that is that the map is contained to some degree. And what we can do is go and speak to those people. And so I should have said this before, sorry. We ask people on the maps to identify important people that weren't there, but that can contribute to the map. So what we've done in the past is present the map, ask them to continue those impact pathways, or we've tested the program theories with them as interview participants. So that's one way of looking at it, to say time naturally stops the map from going too much. And it depends what you're trying to do. If you're trying to capture everything that's happened, and encourage you to look at the work that Nobles and Dr. Jen Hall have done, where the map has continually got, I say, taller, wider, and captured so much from a surface level view. There's so much going on that could be quite cause fear of people to even dive into. So actually,
because they can look overwhelming, those maps.
Yes, very much. And we try not to share them directly in any reports. We'll do screenshots of pathways and similar, so that people can, like, especially with the people we're working with aren't academics, evaluators. They want to know what's the key thing here. So here's the pathway and here's some of the findings that represent the map. yeah, it might be for people that one workshop is enough, and then they just want to go have some interviews, conversations, similar methods to dive deeper. Ultimately, that discovery workshop draws the boundary. So whilst, say, I go back to, like, if transport are involved, the person commissioning the group saying, well, actually, that's not important right now. What we're focusing on is this. So that brings us back to say, okay, and we've done it in the workshop. People have gone on that tangent. We said, oh, can you tell me more about this pathway to bring that attention back there? So within the
that's quite a skill as
facilitation
well,
time.
isn't it, as a workshop facilitator to do that? Because I've run these sort of things before, and when I mean, it's like I don't know, my brain's all over the place today. I think it's the heat. It's certainly getting hotter here at the moment. One of the things I'll say to the PhD students that I do train is that, eyes on the prize. What is it you want at the end? And whilst these alternate pathways are very interesting, they may not be relevant for you and your research question, if you like. So for you, yours is bounded by the funding, which asks you to answer specific questions. So in the moment, that's quite a skill to be able to, especially when people want to, tell you about the thing that they want to tell you about. That's very important to them to get it off their chest.
Yeah, and I think the one thing I've learned is, like you say, get off their chest, but actually where we encourage them, this is your map, you can continue to use it. Quite often it's okay for the evaluation, this is what we're looking for, but how might you use this as an ongoing reflective and evaluation tool? So we had it up in Northumbria recently, where people were very passionate to take it away. So we took obviously what we needed for the evaluation side of it, but then with Miro board, so this is your map, keep adding to it, keep using it for what works for you, because that is different to what the evaluation ask is. And quite often you'll see across, if you bring 30 people in the room, they've all got everyone's got something different that's important to them, haven't they?
Yeah, it's about people's agendas as well, and needing to sort of voice that. So Lisa Williams has asked a really, I was going to say intelligent question, but that actually makes it sound like all the other questions are not intelligent. So I think that's a bit of like a backhanded compliment. So I apologise for that, Lisa. But actually, it's a really good question. Do you want to come on and speak to Director Louis about it? It's around workshops and whether you would have separate groups. So do you want to ask your question, Lisa?
Thank you. Yeah, thanks, Louis. This is all so interesting, and thanks so much for a fabulous talk. I am an All Wales lead. So in Wales, I lead a dietetic programme called Nutrition Skills for Life, and we train others, community workers, to then deliver programmes within communities. One of those is something called Foodwise for Life. We're looking at doing a realist evaluation of that, and I've sort of developed a protocol and thinking, realist interviews are the way forward with 3 groups. At an organisational level, it would be the partners that we're working with across leisure services, local authorities, and also within health. Then it's also the facilitators, so the people dietitians trained to implement that programme. And then there's also the participants themselves. So looking back at data, programme data we've already got in terms of that documentary analysis and some of the quantitative stuff. But now I'm thinking some of the things you've just described would be brilliant, but what should we, would you, and I know you were saying about perhaps doing things separately. I think that's what I gleaned from what you said in the presentation, that maybe you would keep it separate because you don't want to make, for lots of different reasons that you described. But if in terms of the practicalities of this going forward, what would your advice be, and were there any sort of similar parallels with the work that you've done in terms of, do we privilege the voice of the participants first? Or do we go to, what would your advice be around the order in which we should do things?
So based on for like public participants, program delivery team, senior leaders, my assumption would be that the senior leaders and public delivery team would be able to map out the process to get to the point that the public participants are involved. So maybe those 2 groups together. And we've struggled to have members of the public or like end users that weren't like come to actual workshops, and that's where we tend to do different approaches conversations, focus groups, going along to sessions and actually speaking to those individuals, which is completely understandable because most of the time workshops are during the working day, or it's not necessarily at their convenience. So I imagine professionals in the room shouldn't be a problem. As with anything, you might know more about personal relationships, things to mitigate. We've had some say like CEOs or director of public health roles that we've had to just follow up with a one-on-one interview with 3 months notice, as is always the way. But definitely with public participants, I think that is an opportunity to go to them and work with them in their environment where they feel comfortable and safe to contribute. Again, we've seen people do ripple effects mapping with children, go along to a youth club, come and do some mapping for half an hour. We're going to make it a bit more engaging, whereas professionals tend to just want to do the job, rather than like make it too much about them. So you could take a map that you've done with the senior leaders and delivery team, which I would expect the public participants can then continue those pathways. So, okay, the session started focused on this, and then this is how it worked for these participants. But you could always just do a separate public participants one where the start is the sessions, the activities, the engagement. Okay, what did that lead off to? The only challenge, I guess, the participants might not cross over or connect with one another. So you might be collecting like individual stories or ripple effects, which you might choose to do like stories of change or a different approach to capture those individual stories and then bring them together rather than ripple effects mapping.
Does that answer your question, Lisa? Is that helpful?
Thank you. That's really helpful. Thanks so much.
I think there's a fair bit of overlap in your work and my work, especially around the dietetic stuff at the moment. So has anyone else got any questions for Louis? I mean, I personally think it's fascinating. It's a really, really useful tool. Like everything in realist work, it's very time consuming, I would imagine. But I think that's the nature of the beast, I think, with realist work. But I think this is very revelatory. And it's a really one of those approaches that I think is truly participatory as well, which I think as realists, we're always trying to do work that definitely heads more in that direction. So unless anyone else has any other questions, I've asked quite a lot already. We can finish a little bit early and I can give you a little bit of your life back in terms of an extra 15 minutes or so for you to go and enjoy the sun outside, if you're in the UK, that is. If you're elsewhere, I have no idea what the weather's like. But it's very hot here in the UK at the moment. So thank you so much, Louis. As usual, I will stay on at the end of this call. So if anyone has any questions about realist work, whether it relates to what Louis has spoken about or whether it's about another aspect of doing realist work, if you stay on the end of this call, I will always, assuming I don't have anywhere else to go, help anyone who needs any help. So if not, I will hopefully see you at the next Realist Hub seminar. So thank you very much, Louis, and thank you. It's brilliant talk.